It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care, so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. In the last blog I talked about part 2 of the 10 signs to look for if your critically ill loved one is in the right intensive care unit, and that was part 2. You can check out last week's blog by clicking on the link below this video, and you can also check out part 1 of the 10 signs to look for if your critically ill loved one is in the right intensive care unit, again by clicking on one of the links below this video. In this week's blog I want to talk about the 6 most dangerous trends families of critically ill patients are currently facing in intensive care, and that's part 1. Before I get into today's topic, I want to share a quote with you that I wrote on today's topic, and the quote says, "A trend is defined as a general direction in which something is developing or changing. It's therefore that you and your family need to be familiar with the latest trends and developments in ICU if your loved one is critically ill in intensive care." A trend sounds like it's something fashionable or even desirable. However, when it comes to your loved one's critical illness in intensive care, all you care about is results and outcomes and not trends. Intensive care teams take different viewpoints, and from their perspective it often is about the latest trends in intensive care and how it applies to your critically ill loved one's care and treatment. The truth of the matter is that the latest trends in intensive care often include medical research and experimentation beyond your wildest imagination that may or may not be in your critically ill loved one's best interest. Your role, as always, is to ensure that your critically ill loved one is getting the best, most up-to-date and free from bias care and treatment. Care and treatment in intensive care must never be a result of what's happening behind the scenes in intensive care, where hidden agendas often rule and results in inferior care and treatment. So, let's get into today's topic. After more than 15 years intensive care nursing in 3 different countries, where I literally worked with thousands of critically ill patients and their families, and where I have also worked as a nurse unit manager for more than 5 years, I have seen a lot of trends come and go in intensive care. I also have a very good feeling what's currently trending in intensive care, not only because I'm still working in the environment on a part-time basis, and I also have a very good understanding because of my constant interactions with you, a family member who has a loved one critically ill in intensive care. The interactions I have with you are through my one-on-one phone and Skype counseling and consultation service, or through my one-on-one email counseling and consultation service. Trends, as you're well aware, can come and go. They can be fads, and they can also grow into something bigger. The bottom line is that most of the current trends in intensive care worry me deeply, and I think if you don't know about these trends, you, your family and your critically ill loved one will be in big trouble. So, therefore, let's start and get right into it. The first current trend that's worrying me in intensive care is medical research in intensive care. Unbeknownst to most families in intensive care, medical research is everywhere in ICU. The fact of the matter is that your critically ill loved one may be enrolled in a medical research study without you, your family, or your critically ill loved one knowing or let alone having given either written or verbal consent. This could mean that the intensive care team is trialing a new drug, a new piece of equipment, or sometimes even trialing conservative management, which means no surgery versus surgery, as part of a medical research study. I could fill an entire book about medical research studies that I have come across in intensive care, and I have found most of them highly questionable. I do believe that medical research has its time and its place, but certainly not with the most vulnerable patient group that there is, which are intensive care patients. I do believe that medical research in intensive care has gone completely out of hand, and the money that's attached to it has uncontrollably spiraled into the millions and tens of millions of dollars per year in individual ICUs. Therefore, the stakes are extremely high for intensive care teams to get their hands on funding for medical research, because it has become such a massive revenue driver. Medical research has also become a discipline where some intensive care units are trying to build their reputation on. The more medical research, the more revenue, the more medical research papers they can publish, and the better their public reputation, and the list goes on. From my perspective, medical research is often highly questionable from an ethical and moral point of view, and it's not transparent most of the time. There is way too much stuff happening behind the scenes, or behind the curtains, so to speak, where you as a family member of a critically ill patient in intensive care have no idea about and no control over. The bottom line is that if your critically ill loved one is in one of the following situations, where they are either very unstable and in a very critical condition, or where they are in a life-threatening situation, or where they are not waking up after an induced coma, or your loved one may be in intensive care for long-term treatments and long-term stays, including long-term ventilation, or your loved one may be having a severe or traumatic head or brain injury, or your loved one may be threatened with an NFR, not for resuscitation, or DNR, do not resuscitate order, or your loved one may be in a situation where the intensive care team suggests a withdrawal of treatment or a limitation of treatment as being quote-unquote in the best interest for your critically ill loved one, or your loved one may even be approaching their end of life in intensive care. In those situations, you certainly don't want to have the intensive care team experiment with your critically ill loved one and conduct medical research on them. That's not what you or your critically ill loved one signed up for. The truth of the matter is that medical research in intensive care has gone completely out of hand because of the million-dollar figures and the prestige that comes attached to it. Life-saving frontline services in intensive care often suffer as a consequence of it, because money and other resources have been reallocated where certain patients who are often secretly enrolled in a medical research study are given preference above other critically ill patients. Unless you have insider knowledge like I do, this will play out in ways that only an insider can identify, evaluate, and also manage. Look up some intensive care units' websites. They literally brag about their medical research activities, the funding attached to it, and the medical research papers they publish. It's all in the name of science and academia, and frontline health services are paying the price. What the intensive care team hasn't told you is that if they try and sell you and your critically ill loved one on a withdrawal of treatment or a limitation of treatment as being quote-unquote in the best interest for your critically ill loved one, They certainly haven't told you that your loved one hasn't been enrolled in a medical research study, and therefore they may have lost interest in your loved one's case. On the other hand, if your loved one is enrolled in a medical research study, they may unnecessarily continue treating your loved one, prolong their suffering unnecessarily, with the result that they may die anyway. As you can see, intensive care is a very complex, dynamic, volatile, and also highly political environment. If you think that what you see is what you get, you are dead wrong. Let's move on to number 2. Intensive care is a multi-billion-dollar per year industry, and it comes with a lot of baggage. As you would have seen by now, intensive care units come with a lot of baggage. It's never straightforward, and once you have a loved one critically ill in intensive care, you would have found out by now that it can be very, very complex. Intensive care units on the one hand can be a massive revenue driver for hospitals, as it tends to be the area in a hospital with the revenue going in and out. We are talking about hundreds of millions of dollars per year in big intensive care units. On the other hand, when treatment in intensive care is not straightforward and your critically ill loved one's stay is prolonged and complicated, the intensive care team is doing the maths in their head. They're continuing to count the beans, so to speak, and they will try and change the positioning and the meaning of your critically ill loved one's care, treatment, as well as their diagnosis and prognosis, if it suits them. You've got to watch every move and every communication from the intensive care team like a hawk. If you can't interpret the meaning behind the intensive care team's communication or lack of such, you are in serious trouble, and you'll end up like the 99% of the families in intensive care who make no informed decisions, who have no peace of mind, no power, no control, and no influence. Number 3. Intensive care units are not family friendly. Now remember, we are living in the 21st century, and most of you watching this are living in free, open, and democratic countries and societies. You would think that if your loved one is critically ill in intensive care, you'd find similar openness and democratic processes. You'd be pretty disappointed if you think that way. The minute you come to an intensive care unit, you'd probably find yourself in a waiting room or in a reception area of an intensive care unit, and you'll find that you can't just walk into the intensive care unit to see your loved one who may or may not be on their deathbed. The fact of the matter is that in most intensive care units you can't just walk in, you need to ask for permission. Fair enough, and I have also seen my fair share of totally inappropriate non-family members making visits to critically ill patients in intensive care. Therefore, a healthy level of scrutiny is appropriate. However, what's certainly not appropriate is to limit visiting hours to something ridiculous like 10 a.m. to 12 p.m. and 6 p.m. to 8 p.m. in this day and age. I still see those limited visiting hours in some intensive care units, and it's so old-fashioned, controlling, and outdated, period. When I see limiting and restricted visiting hours like this, I always wonder if those intensive care units have anything to hide. And it's a question you should ask yourself as well. The next thing that worries me is that most intensive care teams send families of critically ill patients away from the bedside when they are doing their ward rounds and examinations. The ward round in essence is one of the most critical times during the day for a patient in intensive care and their family, because care, treatment, diagnostic results, trends and outlooks will be discussed by the intensive care team, and yet they don't want you to be there. Really? Remember, it's one of the most critical times of the day, and there should be openness and transparency towards families when it comes to ward rounds. Period. What do the intensive care teams have to say during a ward round that they can't possibly openly discuss with you and your family? Most of the time, intensive care teams will send you away from the bedside, citing privacy reasons for sending you out, and they will tell you that they will discuss with you later about their findings in the ward round. You'll probably be bitterly disappointed because it'll take the intensive care team a good few hours before somebody from the team will actually talk to you and give you the updates that you have been desperately waiting for. This dangerous trend that intensive care units are not family friendly is really one of the most worrisome trends that there are, and it goes contrary to your quest of making informed decisions, get peace of mind, control, power, and influence. How the hell are you going to make informed decisions, get peace of mind, control, power, and influence if the intensive care team is trying to lock you out during the most part of the day and won't let you participate in the most important part of the day at the bedside? Keep in mind, you'll only get what you ask for. Therefore, you need to stand your ground, because in life, you don't get what you deserve. You only get what you negotiate. So, look out for part 2 of the 6 most dangerous trends for families of critically ill patients are currently facing in intensive care. It'll come out in the next few days. So, how can you become the best advocate for your critically ill loved one, make informed decisions, get peace of mind, control, power, and influence quickly once your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you learn quickly how to make informed decisions, get peace of mind, real power, and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests, how to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care, and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's blog, and I'll see you again next week in another update. Make sure you also check out our Your Questions Answered section, where I answer your questions, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our contacts tab. Also check out our ebook section, where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype or over the phone, and also via email by clicking on the email and phone counseling tabs on the top of the website. This is Patrick Hutzel from IntensiveCareHotline.com, and I'll see you again next week in another update.